Hello, everyone. My name is Lanicia Rest, and I am the Executive Director of March for Moms. We're excited to bring you our 5th annual rally virtually, repeating the town hall format from 2020. While we would have loved to stand with you all on the National Mall again this year, we are fortunate that people from all over the country have the opportunity to join us and listen to our speakers today. For those of you joining us for the first time, March for Moms aligns the diverse voices of families, healthcare providers, policymakers, and partners to advocate for mothers and families' health, well-being, and equal access to care. Year-round, we work as a collective to advocate for life-saving improvements in healthcare practices and better access to maternal health care. We host events such as this one to bring together the diverse voices that support the health and well-being of all birthing people and their families. This year, we are marching to eliminate disparities in maternal health care by highlighting the Black Maternal Health Momnibus Act of 2021. You all may be familiar with the statistic, Black moms or birthing people are dying at 3 to 4 times the rate of their white counterparts. The stats for other birthing people of color are also alarming. To address the maternal health crisis in America, congressional leaders have been fighting for critically important policies. Congresswoman Lauren Underwood, Congresswoman Alma Adams, Senator Cory Booker, and members of the Black Maternal Health Caucus introduced the Black Maternal Health Omnibus Act of 2021 to address every dimension of the maternal health crisis in our country. Our amazing lineup of speakers will share their experiences and discuss the importance of having policies that address disparities so that birthing people in our country can thrive. Before we kick off with an introduction and special remarks from Congresswoman Lauren Underwood, I want to give thanks to our small but mighty steering committee that assisted in planning this event today, and our sponsors, Maven Clinic, the National Association of Nurse Practitioners in Women's Health, the American College of Nurse Midwives, and the Society of Maternal Fetal Medicine. Our steering committee will also be in the chat to engage and answer any questions you may have throughout the event. Congresswoman Lauren Underwood serves Illinois' 14th Congressional District and was sworn into the 116th U.S. Congress on January 3rd, 2019. Congresswoman Underwood is the first woman, the first person of color, and the first millennial to represent her community in Congress. She is also the youngest African-American woman to serve in the United States House of Representatives. Congresswoman Underwood serves on the House Committee on Veterans Affairs and the House Committee on Appropriations. Congresswoman Underwood co-founded and co-chairs the Black Maternal Health Caucus, which elevates the Black maternal health crisis within Congress and advances policy solutions to improve maternal health outcomes and end disparities.
Hi, everybody. Welcome to the 5th annual March for Moms rally. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District, and I'm the co-founder and co-chair of the Black Maternal Health Caucus. I am so delighted to be joining you for this year's virtual rally, and I want to thank the leaders, board members, and supporters of March for Moms all across the country. Ever since the very first March in 2017, your organization has been a leading voice for moms and their growing families, and your tireless advocacy has made a massive impact, helping to both elevate maternal health as a national priority and advance critical policies to save lives and end disparities. This work could not be any more urgent. You've likely heard the statistics by now. In the United States, the wealthiest country on earth, we have the highest maternal mortality rate in the industrialized world. And for women and birthing people of color, the risks are even greater. Black moms are 3 to 4 times more likely to die from pregnancy-related causes than white moms, and Hispanic, Asian, and Native American birthing people also experience elevated rates of maternal mortality and morbidity. As a co-chair of the Black Maternal Health Caucus, I'm committed to the critically important mission of advancing legislation to save moms' lives, end racial and ethnic disparities, and achieve true equity and justice for all. And to address the root causes of maternal mortality, morbidity, and disparities, we need data-driven, evidence-based policies that center the voices of families impacted by this crisis. That's why in February of this year, I introduced the Black Maternal Health Momnibus Act with Senator Cory Booker, Congresswoman Alma Adams, and now more than 150 House and Senate co-sponsors. The Momnibus, which I first introduced in 2020 with then Senator, now Vice President Kamala Harris, is a suite of 12 bills that build on existing legislation to comprehensively address every clinical and non-clinical driver of this crisis. For example, the Momnibus includes policies to provide trainings on bias and racism to maternity care providers, ensuring that clinical care is consistently respectful and culturally appropriate for every pregnant person and new mom. But the legislation also recognizes that social determinants of health, like housing, transportation, and nutrition, also impact outcomes for moms and babies. The Momnibus includes funding to ensure that every mom has access to robust social services throughout pregnancy and for the full year-long postpartum period and beyond. The legislation also includes provisions to support incarcerated moms, as well as people suffering from mental health conditions or substance use disorders during or after pregnancy. There's funding to grow and diversify the perinatal workforce, enhance data collection initiatives, expand access to digital tools, and address the impacts of COVID-19 on pregnancy. These are necessary investments that will save lives and support families. And thanks to your advocacy, we're already making huge strides to move this legislation forward. Last month, the House of Representatives passed my Protecting Moms Who Served Act with unanimous bipartisan support. This bill would make critical investments to address maternal mortality, morbidity, and disparities among veterans. It's the first bill in the Momnibus to pass the House, and I will need your help to get this bill and the entire Momnibus signed into law. We have a unique window of opportunity to get this done, so make sure your members of Congress hear from you. Reach out to your representative and senators and let them know why you're committed to this issue and what policies we must advance to ensure that every mother has access to the care and support they need and deserve. Through your voices, your stories, and your advocacy, we can pass the Black Maternal Health Momnibus Act and save moms' lives. Thank you for shining a light on these issues, and thank you for all the work that you do. I'm so honored that you invited me to join you for this event, and I look forward to the day that we're rallying together on the National Mom once again. But until then, have a great conference and take good care of yourselves.
Underwood for being a champion of improvements to maternal health care in our country.
I'm happy to introduce Charles Johnson to our virtual stage. After the sudden passing of his wife, Kira, due to complications following a routine scheduled C-section, Charles has dedicated his life mission to launching the For Kira, For Moms Foundation, a nonprofit committed to reducing the maternal mortality rate and raising awareness about the maternal death crisis in the United States. Charles is also a board member of March for Moms. Currently, For Kira, For Moms is working closely with congressional legislators to pass the Kieran Johnson Act, a bill within the Black Maternal Health Momnibus. Charles, take it away.
All right, Morgan, thank you so much. Everybody, March for Moms family, let's go, let's go, let's go, let's go. I am so excited to be here. I have 5 minutes and I'm going to step out of the way of greatness because Lanicia and the team have put together an amazing program today. But I have to say first and foremost that it is amazing to be here with my family of advocates, of stakeholders, of folks that are out there on the front lines fighting and catching babies. I want to send all of you love and well wishes. With that being said, one of the things that I love the most about this group is that we take on the hard things. We take on fights that seem insurmountable. And as I was preparing to spend time with you all today, I couldn't help but think about looking back in 2017 when we were together on the National Mall fighting for the Preventing Maternal Deaths Act. And at that time, it was something that seemed like such a long shot. And everybody told us that it would never happen. And everybody told us that women's health issues weren't a priority. And guess what we did? We made it happen. So it only makes sense. It would only make sense that we would come back in support of something as bold as the Momnibus Act, with over a dozen bills specifically addressing the Black maternal health crisis, right? And so I'm so proud to be here with you, standing in solidarity, making this happen. So it is my job to speak to you specifically this afternoon about the Kieran Johnson Act. And I'm so honored that this bill is named for my late wife, Kieran Dixon Johnson. So this bill is going to do several things that I'm extremely proud of. First and foremost, it's going to provide funding for community-based organizations specifically addressing the needs of mothers and babies. It's also going to provide funding to implement implicit bias training. It's so critical. It's so critical that we have tools for providers to make sure that they are meeting the needs in a way that is culturally competent of the families that they serve. And last but not least, this bill and this legislation is going to take very important measures towards accountability and transparency for providers by establishing a respectful maternal care compliance offices that will be located within hospitals but are independent from hospitals. So in the event that families have experienced bias, that have experienced a lot of the issues that we're seeing far too often, there will be a place to be able to report these instances within the hospitals that are independent from the hospitals. And very importantly, our federal government is going to publish that data. So it's a huge step towards the transparency and accountability that we need from providers. And so in closing, what I want to say is that I am so excited to be here, but I am looking forward towards next year. I am excited. And so for Lanicia, for the board, for the members of this team, I am saying right now that next year in 2022, we will be back on the mall all together, giving each other hugs, having the biggest, most amazing celebration of passing the Black Maternal Health Momnibus, and then talking about what we're going to do next. So with that being said, thank all of you so much. And I'm looking forward to seeing and continuing to do wonderful things together with all of you. Be well.
All right, thank you so much for that, Charles. Next up, we have Kelli Dillon. Kelli Dillon is the Executive Director for Back to the Basics Community Empowerment, co-chairperson for the Empowerment Congress Southeast Neighborhood Council, and newly appointed Commissioner for Housing and Community Investment Department, Community and Family Services for the City of Los Angeles. Kelli is a survivor of domestic and gang violence, an advocate for violence prevention and intervention programs. Kelli found herself incarcerated at the age of 19 years old and was sentenced to serve a 15-year sentence. Kelli was featured in the documentary Belly of the Beast, which exposes modern-day eugenics and reproductive injustice in California prisons. Kelli has received several awards for her passionate work, including the 2019 Pioneer Woman of the Year Award from the Los Angeles Commission on the Status of Women, and continues to volunteer her time in the community of Los Angeles. Please welcome Kelli Dillon.
Hello, everyone. My name is Kelli Dillon. Thank you so much, Lanicia, for inviting me. The Momnibus is such an amazing event. I'm very proud and privileged to be a part of this. And so my focus is on the bill or the act, the Justice for Incarcerated Moms Act, that will actually bring funding and bring grants to community-based organizations, medical-based organizations that will help to, that will really help to serve those that were incarcerated moms, right? Justice for Incarcerated Moms Act. It will help to give them the care that they need. I wanted to just quickly speak on my experiences, which I get a little nervous about because I'm a survivor of forced sterilizations that happened while I was incarcerated at the age of 19. I've been now in the state of California really trying to focus on getting the compensation and reparations for over 400 other women, mostly women of color, African-American women, indigenous immigrant women that were housed in not only state facilities, but we know that sometimes the state criminalizes mental health. So those individuals were also sterilized while pregnant and giving birth, after giving birth while incarcerated and housed in California facilities. So for me, the Justice for Incarcerated Moms Act really would bring forth the true protection of mothers while incarcerated, because we know that they have been shackled, while giving birth, which contributes to some of the birth defects, as well as the the medical health and the postpartum health of the women while they were giving birth. And then they were also forcibly, non-consensually, and coercively sterilized as a result. And so I'm really happy to just be speaking on this bill. When I speak on it, it still has a very personal, emotional feeling for me. So I apologize if I seem a little nervous, but just speaking on it sometimes is a lot. But I'm really hoping that this bill will address the women and give them the care, give them the protection, give them the space that's needed in order to heal, when they're able to allow community-based organizations and community medical facilities to be able to come in and make sure that they have the space to not only get over the trauma of what has happened to them, but also support them in their journey to motherhood, or becoming moms again. So I just want to thank you, Miss Lanisa, for allowing me to speak on behalf of my own truth, and also for the Incarcerated Moms and the Incarcerated Moms Act. So I appreciate you.
Thank you so much, Kelli, for sharing your experience here today and for all of your advocacy on behalf of incarcerated women and people. It's now my pleasure to introduce Trudy Russell. A Los Angeles native turned New Yorker, Trudy has turned her pain into her passion, advocating for Black women and their right to be heard. In 2013, Trudy became pregnant and lost her baby at 6 months due to complications that could have been prevented. Trudy has since become a maternal and mental health advocate, especially in the Black community. She has also become a mother again, crediting her second child with showing her exactly who she is, a woman who can overcome with tenacity, grace, and dignity. Trudy has felt the call to service and credits her first daughter, Journey May Ling, with giving her the opportunity to share her story and passion with you here today. I'll turn the virtual stage over to Trudy now, who will speak on the Moms Matter Act.
Thank you so much, Hope. Being here and using my voice to advocate for myself, my angel baby, and other Black mothers like me who have or had no clue about the seriousness of pregnancy and childbirth. I had heard stories of women dying from complications of childbirth, but they were scarce. And so far, I felt from my reality that when I got pregnant, this type of tragedy was not even a consideration of mine. I had received no information or statistics on my demographic or what to do in preparation of anything going wrong. In my first doctor's visit, I was congratulated on a pregnancy, had a normal checkup, and was told to make my appointment for the following month. As I think back on my first trimester, that summer of 2013, I had no clue that by the end of that year, I would have lost a child and would be fighting for my life due to the negligence of my medical provider. I live in New York City. My doctor is located in Soho, a neighborhood synonymous, I felt, with wealth and good health care, but I got everything but that. My near-death experience came from HELP syndrome, an even more exaggerated form of preeclampsia. Before tragedy struck, the warning signs were there, and I went to my doctor to inquire about what I was feeling. Was this normal? I didn't feel well. My stomach was upset, my body was swollen, and I was extremely uncomfortable. More importantly, I experienced vomiting in my third trimester and had developed an excruciating headache that lingered. Instead of a closer look into my condition, I got the okay to travel across the country to a trip home that I had planned for Thanksgiving. I'm a Los Angeles native, where all of my family resides. The only blessing that came out of going to LA was the fight for my life was not alone. I had my people standing in the need and praying for me and my child, Journey May Ling, to pull through. After such an experience, it took months of mental reconciliation to grasp all that had happened. I needed help, mind, body, and soul. Never did I think that meeting my child for the first time would be through her transition from this earth. It made me angry, but I had become angry with a purpose. This was the flame that ignited my fire. I researched to understand the condition, and in doing so is where I learned about the statistics of Black women in pregnancy, racism as it relates to Black women in medicine, how we are perceived as having a higher tolerance level for pain and tragedy and ignored when raising a concern. I decided to use my voice to speak out, my body to show up in March with the Pre-Eclampsia Foundation, and the memory of my firstborn to advocate for Black women, our prenatal care, and our postpartum care. It's taken years of therapy and having a second chance at life and motherhood for restoration to come to me. Journey made me a mother, but mahogany has given me the opportunity to mother. If the Black Maternal Health Momnibus Act of 2021 was in place when I lost my child and had my near-death experience, I believe it would have made a world of difference with regard to having the knowledge that as a woman of color, I'm more susceptible to complications of pregnancy. And for that reason, I'm covered and protected under a law that advocates for my physical and mental well-being. This bill can begin a path toward ending disparities across maternity care through seeing Black bodies as equal to our white counterparts. We will get the same treatment, be heard, and taken seriously as expecting mothers who want to flourish in life and motherhood. For more of my story, you can follow me on Instagram at journeys.mother, where in my bio, you will find my Women's Health Magazine article. Thank you for your attention and time.
Thank you so much, Trudy. That was wonderful. It is my pleasure now to introduce Dr. Annie Crear-Murray, who's a former Navy pilot turned licensed clinical psychologist and neuropsychologist in San Diego, California. She's currently the head of the Department of Defense's largest substance abuse rehabilitation program at Naval Medical Center in San Diego. There, she specializes in trauma treatment, brain behavior, and cognition of active duty service members with a history of substance abuse, acquired brain injury, and combat trauma. Following the birth of her son, Annie experienced life-threatening complications, which later catalyzed her maternal health advocacy. She acts as the advocacy and community liaison with the Every Mother Counts to ensure a safer pregnancy and birth for every woman everywhere. And I'll turn it over to you, Annie.
Hello, good afternoon, everybody. My name is Dr. Annie Murray, and I'm the Advocacy and Community Liaison for the nonprofit organization Every Mother Counts. Founded in 2010 by Christy Turlington Burns, Every Mother Counts works to ensure that every woman everywhere has access to safe, respectful, and equitable maternity care. Today, I'm here to speak to you about the bill protecting moms who served because of my role as a military officer, mental health provider, leader, and most importantly, mother. Much like one of the bill's sponsors, Senator Duckworth, I too was a helicopter pilot. We actually flew the same type of airframe or type of helicopter. While I've also deployed multiple times throughout my career in support of Operation Enduring Freedom, Operation Iraqi Freedom, it wasn't until childbirth that I nearly lost my life after experiencing multiple postpartum hemorrhages. By looking at me, or the ribbons and medals that I wear on my uniform for that matter, you can't tell that I'm missing my uterus, fallopian tubes, and cervix. I'm thankfully alive today because of the life-saving care I received at a military hospital. Throughout my postpartum complications, unique military stressors further complicated my recovery. My husband, a helicopter pilot, deployed when I was just 4 weeks postpartum, literally in the middle of everything. I was left to deal with the weight of raising a newborn and a 22-month-old son alone while trying to reconcile my experiences with the emotional and physical trauma of what my body had gone through. Like many military families, I didn't have family nearby, and I relied on the support from other military friends and families who are overburdened themselves. It's not surprising that rates of perinatal mood disorders are significantly higher in military populations than in civilian populations. Despite how difficult all this was, I benefited from enormous privilege. The military's maternity leave program at the time allowed me to take 18 weeks of paid leave to be with my children, taken at my discretion and on my timeline. I had healthcare coverage that provided postpartum care and support services such as breast pumps and lactation consultation. I had access to mental health care when I needed it the most. As a military clinical psychologist now, I've been privy to hearing the stories and experiences of many perinatal women who serve in the armed forces. What I know more than anything is that just as women's experiences are uniquely their own, colored by their cultural and environmental experiences, so are those of service women and veterans. They don't fit nicely into any mold, and therefore we can't stereotype their experiences as the same. We need to recognize the military culture as one aspect of a mother's experience, not the entire essence. With that, we call upon maternal health care providers and settings to gain a deep understanding of the needs of our service women and veterans, as non-military providers will have increasing responsibilities in treating these birthing people. We need to anticipate and prepare for service women and veterans to have access to midwifery and doula services and more evidence-based and patient-centered care. Recent data has clearly shown that racism impacts maternal health outcomes, and therefore we need to better understand how to improve maternal health outcomes and birth equity among service members and veterans. There are more women serving in the US military now more than ever, and women veterans are the fastest growing demographic in the VA system, with around 40% of women veterans and those using VA healthcare of childbearing age. Among these women across military services, diversity is more common than within the civilian population. However, much lower representation exists in the higher ranks of power within the military. So what will this bipartisan Protecting Moms Who Serve Act do? It will first create maternity care coordination programs at VA facilities to provide veterans with quality and respectful maternity care, which would include coordination of maternity care between VA and non-VA facilities, access to community resources to address social determinants of health, mental and behavioral health screening support and treatment, and additional supports like childbirth education classes, parenting classes, nutrition, lactation consultation, and breast pumps. It will also commission the first ever comprehensive study on maternal health among pregnant and postpartum veterans with a critical focus on racial and ethnic disparities in maternal health outcomes. The Protecting Moms Who Serve Act is the first bill of the Black Maternal Health Momnibus to ever pass through the House of Representatives, putting it one step closer to becoming law. And we heard Representative Underwood say that now it's up to Senate to pass the Protecting Moms Who Serve Act to take this critical first step for pregnant and postpartum veterans. So how can you help? So after being in the military for many years, I know that most people respect the sacrifices made by servicemen and women and veterans, and they truly want to show their thanks and support. I can't tell you how many times I've been out in uniform at the grocery store, or the post office, my son's preschool, and very well-intentioned people and kind people come up to me to thank me for my service. While it's a heartwarming sentiment, I urge you all to show your thanks and gratitude by advocating for concrete policies that support them and their families. To thank me for my service, call your senator, tell them to pass the Protecting Moms Who Served Act. To thank me for my service, tell your network, tell your community to advocate for the Black Maternal Health Momnibus. To thank me for my service, listen to service members and veterans and what we've experienced and where we need support. To thank me for my service, encourage community providers to gain culturally congruent competencies regarding service members and veteran birthing people and families. That is the kind of thanks I want. Thank you for your time.
Thank you so much, Dr. Reader Murray, for sharing your truth and for sharing calls to action. I am now incredibly happy to introduce Aquene Watkins-Wise. Aquene embodies her mantra, "I can and must make a difference in my world." Through her work teaching high school students, as well as her business, Royally Fit, a mobile wellness program that provides education, access, and resources to historically disadvantaged Black and Brown communities in Pittsburgh, Pennsylvania. Aquene is a proud wife to a U.S. Air Force veteran, mother of 4 young children, extreme couponer, and shark enthusiast. I will now hand it off to Aquene, who will speak on Medicaid extension and the Impact to Save Moms Act.
Whoo, y'all. First of all, thank you all so much for sharing and for creating this platform. I am overwhelmingly emotional just listening to all of your stories. So I'm going to try really hard not to cry. But I'm definitely very full right now. And I'm also 6 months pregnant. So very relevant and timely and obviously very emotional. And so I want to share just a little bit about my experience. I, like Morgan said, and I'm a mother of 4 young children. And like Dr. Reader was talking about, my children, several of them were born while my husband was actively in the military. One of them while he was deployed overseas. And so I know very well the toll that that takes on you when you don't have the support that you normally would have of your partner right with you. And when you lean on what you think to be your medical providers to be that support system that you expect to have during your pregnancy and your delivery and postpartum care, and you just simply don't receive it. And so I think my story is probably very closely mirrored to several of yours, but maybe a little different also. And I'll talk about my second birth in that my son, Victorious, who's now 7, was born healthy, normal pregnancy, but while my husband was deployed. And at the time we were not married. And so I was on Medicaid. And I do believe that my treatment while I was delivering and laboring with him was largely affected and influenced by the fact that my husband was not visible in the room with me, by the fact that I'm a brown woman, and that again, I'm perceived to have higher tolerance. I can deal with things. It's fine. We don't even need to listen to her. So there were many opportunities when I would ask questions and strive to advocate for myself, and I was completely ignored. Thankfully, my mother was able to attend the birth midway through. But even at that point in time, very much ignored. I remember distinctly a nurse turning her back on my mom when she was asking questions regarding her laboring daughter's care. And they were like, we'll just get to it when we get to it. And I honestly believe that if the Momnibus was in place, that we would have competent, at least some competent medical providers who are aware of things that, you know, birthing people are in one of their most vulnerable times in their life, and should be supported no matter what the ask is, no matter what the question is, no matter what the concern is. I truly believe that by enacting, you know, bills like this, by passing bills like this, that we're really wrapping both of our arms fully around birthing people and allowing them to have that sense of support, and knowing that not only do you have these people who are supposed to be in your corner and who are supposed to have your back, but who really do and have a sense of competency in the care that they're providing, who you know, have a sense of knowledge in who you are as a Black and brown birthing person, and want to support that, desire to support that, both in cultural competencies, but also in just understanding how our bodies work, and that we do deserve the same equitable access, the same resources that every other birthing person deserves. So I am overwhelmingly appreciative of all of you all for using your voice, of all of you all for being so active in allowing this to even come together, and moving forward, and being committed to, you know, seeing this act come into fruition, because it doesn't matter what type of insurance that a mother has. It doesn't matter, you know, and we certainly shouldn't be, you know, kicked off of our insurance 6 months after, you know, birth, a year after birth, right? Because so many of us still need such a sense of support. I don't care if you're a veteran mom or a first time mom, right? Like, it doesn't change this. I'm carrying my 4th child, and I'm like, whoa, things are so different this time around. And even, you know, my youngest, who is 2, you know, it wasn't that long ago that I had her, but the way that my body is responding is just so very different. And so the support that I need this time around is so very different. And I'm very thankful that I do have a team that understands that I have amazing midwives and amazing doula who understand that and advocate with and for me. But I don't believe that would have been the case 7 years ago, when my husband wasn't there, whenever I was on Medicaid, whenever I was just another brown girl in a hospital in a room by myself, when they didn't think I knew anything or wasn't educated or, couldn't advocate for myself, or they perceived that I couldn't advocate for myself in the way that I should have been able to. This is overwhelmingly important. It is beyond overwhelmingly important. We all deserve to be supported and loved on, if in no other time than in this most vulnerable time of our lives, when carrying and creating new life, when transitioning that life into the world, and in the aftermath, when we're just trying to figure it all out and put all the pieces together, no matter what that looks like for us. So again, I thank you all for allowing me to share my bit of my story, and for you all for all the work that you're doing. Thank you so much.
Thank you so much for sharing your experience with us here today, Aquene, and for just being here with us and showing up so authentically and sharing with us. I am going to introduce this fierce leader next, Dr. Joia Crear-Perry. She is a physician, policy expert, thought leader, and advocate for transformational justice. As the founder and president of the National Birth Equity Collaborative, she identifies and challenges racism as a root cause of health inequities. She is a highly sought after trainer and speaker who has been featured in national and international publications, including Essence and Miss Magazine. In 2020, Dr. Crear-Perry was honored by USA Today in its Women of the Century series and featured on ABC's Nightline's Hear Her Voice. Dr. Crear-Perry has twice addressed the United Nations Office of the High Commissioner for Human Rights to elevate the cause of gender diversity and urge a human rights framework towards addressing maternal mortality. She is married to Dr. Andre Perry and has 3 children. Her love is her family, health equity is her passion, maternal and child health are her callings. Please welcome Dr. Joia.
Always so amazing to be with you, Lanicia, because I hear home when I hear your voice and it makes me feel at home. So thank you all for having me, and thank you for allowing me to be a part of this important work. As was mentioned, the National Birth Equity Collaborative is a Black woman-led and focused advocacy organization that uses reproductive justice as a framework to address the maternal health crisis through policy, practice, and programs. I'm here today to highlight how social and structural forces rooted in racism and white supremacy result in disparate access to the social determinants of health, and rather how greater exposure to risk factors put Black women at a greater risk of maternal mortality and morbidity. But before I jump into how social risk factors are the byproduct of racism in public policy, I want to reiterate that it is racism, not race, that drives the Black maternal health crisis in this country. And when we discuss social determinants or risk factors, we must use a reproductive justice framework to accurately analyze and craft solutions that take those non-medical factors into account. A reproductive justice framework allows us to center not only those risk factors, but also center to the needs of the most marginalized among us, who already face barriers to accessing healthcare, including women, Black and Brown and Indigenous people, low-income folks, members of the LGBTQI plus community, immigrants, young people, those living in rural communities, and people with disabilities. Social determinants of health, also known as the conditions in which we are born, grow, live, work, age, rest, and engage in relaxation and fun. These conditions must be protective factors or social risk factors. Because of the history of systemic racism in this country, we know that certain groups of people, particularly Black and Indigenous women, have higher social risk factors than others. Structural forces perpetuated by racist policies like slavery, the GI Bill, which created wealth for many white families, but also created inequitable systems of housing, food, stability, education, access to care, and safety for Black communities. And Black women are more likely than white women to experience poverty and hazardous living conditions and food insecurity, to live in maternity care deserts, and have difficulty accessing comprehensive reproductive health care services. All of these are examples of how negative social risk factors that are created by structural factors can impact maternal health. To be clear, maternal health care system fails all women in the United States, but especially women of color, and especially Black women. Women in densely populated urban areas regularly face barriers to care as they live in maternity care deserts, as do rural, which does not equal white, communities face an increased burden when it comes to accessing safe and high quality perinatal care. These challenges include clinical factors such as provider workforce shortages, low patient volume, as well as social determinants of health, such as access to transportation and food security. Distinctively, morbidity and mortality rates in the US highlight the fault lines of those intersecting identities for Black women. The interplay of systems of oppression faced by women of color in the US have resulted in not only poor birth outcomes, but also increased the sense of mistrust of the medicalized healthcare community. Addressing social determinants is especially important for reducing rates of maternal mortality and severe maternal morbidity for Black birthing people who are more than 3 times as likely to die from pregnancy-related causes as their white counterparts. This is why NBEC is proud supporter of the Black Maternal Health Momnibus Act of 2021. As we applaud Congresswoman Underwood and Adams and chairs of the Black Maternal Health Caucus and Senator Cory Booker, we want to ensure that the Social Determinants of Moms Act may have key investments. It will establish a task force across agencies and departments to coordinate federal efforts to address social determinants of health for pregnant and postpartum people. Provide funding for safe, stable, adequate, quality housing for pregnant and postpartum people. Study the transportation barriers that prevent pregnant and postpartum people from attending maternity care appointments and accessing important social services. Extend WIC eligibility periods for new moms so that new moms can access nutritious foods, information on healthy eating, and healthcare referrals when they need most. Provide funding to establish and scale programs that deliver nutritious food, infant formula, clean water, diapers to pregnant and postpartum people in food deserts. Study the effects of environmental risk to maternal and infant health outcomes, because we know climate change is real and it's killing all of us, and especially birthing people, and make recommendations to steps to end racial and ethnic disparities in environmental risk. Provide funding for free drop-in childcare access for pregnant and postpartum people. And provide, lastly, grants to community-based organizations who are the stronghold for how any of this is going to happen, and public health departments to address unique social determinants of health needs in their communities. In comparison to the 10 richest countries in the world, the United States comes in dead last of maternal health outcomes, in large part due to these structural factors and social conditions. Black people are subject to, and it's shameful and a disgrace and absolutely unnecessary. The ongoing maternal health crisis, which disproportionately affects us, can be addressed with the right tools and support from decision makers, as improving maternal and infant health outcomes requires addressing these structural and social determinants of health within a reproductive justice framework. The country is currently ripe with the opportunity to undergo a structural overhaul by including an overhaul of the maternity care system. Now is the moment to correct past wrongs and to catch up to the higher standards set by our global counterparts to achieve birth equity. Thank you.
Thank you so much, Dr. Joia, for being here to speak on the many social determinants of maternal health, especially for Black birthing people, and for all the work that you do. I always learn from you, and I know many feel that way. It's now my pleasure to introduce Veronica Adamson. Veronica is a passionate advocate and transformer of women's and children's health. As global head of Philips Obstetrics Monitoring Solutions business, Veronica drives one of the world's leading fetal and maternal solution businesses, and recently led the deployment of COVID-19 wearable fetal monitoring innovations in the first few months of the pandemic. She has deep expertise building new businesses through a needs-based quantitative approach to decision-making, partnership-based platform approach, and empathy-based leadership. She was previously a senior director of strategy, driving digital transformation initiatives across Philips's 20 billion euros consumer and healthcare portfolio, a Monitor Group C-suite strategic marketing advisor focused on platforms, e-commerce, and a data analytics entrepreneur. I'll turn the virtual stage over to Veronica now, who will speak on the Tech to Save Moms Act.
Thank you, everybody, and really glad to be here today. And I think one thing that wasn't shared in that description is that I'm also a mom, and I'm also extremely moved by what I've heard today. And it really brings back to me one of the most vivid and painful memories that I have, which is, laying on the operating bed, watching the clock tick by, and straining with every fiber of my being to hear my son cry. And he didn't cry right away. I'm lucky because he did end up crying, but those moments, we never forget. And I think as moms, we all experience that fear and really passion to, to make sure that this doesn't happen to other moms or worse, is what actually drove me, after that experience, to apply that passion to advocating for, for moms, and using, my voice to do that as a business leader, but also my hands to make sure that technology is available, and that there's an awareness there of what technology can do to help. And that's why I'm so glad to speak a little bit about what I've learned on my journey, about what tech can do, and specifically, in this particular space. And I think there are a couple of things that, I find particularly hopeful in terms of how technology can empower, moms, clinicians, and also decision makers. For me, one of the ways that I feel technology can help is by empowering moms with access to care. We know that something like 30% of high-risk moms actually aren't able to make their appointments. They face heart-wrenching decisions. Do they spend hours, sometimes 2 hours each way, traveling to the doctor, trying to get a hold of a babysitter? Do they do that every day for several weeks, or twice a week for many weeks, up to 40 times potentially during pregnancy? That's an impossible choice for a mom, especially a mom who, may be at risk of losing her job, or who can't afford childcare. We need to do more to help moms who want to be able to access their care but can't make it to the doctor. And that's where I think remote monitoring is such an important aspect of the solution, and figuring out how do we help moms get care in their community, at their home, when they can, especially moms who already have children at home and who really don't have a solution for getting to the doctor as frequently as they would need to. So to me, that's one of the simplest things we can do. It's simple as maybe the wrong word, but it's absolutely one of the most impactful. We know it works. We've seen it in other countries in the world. And we've even seen it in other health spaces, like Holter technology for cardiology. So this is one area that I really am hopeful we'll see some innovation on in the short term. The second area that I think is very powerful is leveraging technology that exists in other health spaces, right? So understanding how to identify when a mom is at risk after they've had a baby with software. Now, there are, of course, a lot of risks to software development that have come to light recently, biases that can actually be in the software, but looking to how we can leverage some of those technologies to look at, hemorrhage earlier, to understand when the mom's blood pressure is of a concern postpartum, other areas where we have the technology to identify those conditions early, and making sure that, we develop them in the right way and put them in the hands of clinicians in a way that's useful to them, and make it more of an objective assessment. So trying to surpass some of the bias that exists with technologies that at some point in time, hopefully will not be biased. And the last area that I think there could, that there's a lot of potential for is not so much the technology itself, but making sure that the data is available. So we've talked a lot about, Momnibus and different factors. And I think that the aspect around data collection is really key, because until we know what the root challenges are, the root causes of the outcomes, and also have the data to understand whether the changes that we're putting in place work, it's going to be difficult for for our decision makers when it comes to reimbursement to be able to advocate themselves for the change. So I think having the data to really understand where we need to act and whether what we're doing makes sense is going to actually help drive this change over time. So those are some of the areas that I see. And again, I'm really grateful for everyone's stories and for everyone's willingness to share, because I think this is what's going to move the needle. And if there's anything that I can do to help, please just don't hesitate to reach out.
Thank you so much, Veronica. I think especially in the last couple of years with the pandemic also happening, we've been all very much reliant on technology, and hopefully this part of the Momnibus will pass and we can see more innovation. Right now, I'm really honored to introduce one of our board members as our next speaker, and that's Ebony Marcel, who is the Director of Midwifery at Community of Hope Family Health and Birth Center in Washington, D.C. Prior to her current position, Ebony was the Administrative Chief of Midwifery Service at MedStar Washington Hospital Center. She has been recognized by the American College of Nurse Midwives with the Young Whippersnapper Award for midwives excelling professionally with less than 10 years experience, and by Save the Child for their Real Award Midwife Honoree. She completed the Duke University and the Johnson & Johnson Nursing Leadership Fellowship, and this year she will complete the Equity Labs Seeding Disruption Fellowship. Ebony is really known for her passion in midwifery and midwifery's role in social justice. She continues to build culturally aware midwifery with driven clinical models of care, specifically for underserved Black women. She currently serves on the following boards: March for Moms, National Association for the Advancement of Black Birth, and the American Association of Birth Centers. She resides in Washington, D.C. with her husband, stepson, daughter, and 2 fur children. Welcome, Ebony.
Hi, everyone. I'm so happy to be here. It's always so weird when people are reading your bio. I'm like, oh, did I do all that? Okay, I guess, sure. And also, I'm also thinking I need to shorten it. Anyways, they gave me 5 minutes, y'all. So I'm gonna work really hard to be focused and targeted. And for those of you that know me and really love and accept me as I am, this is hard. Today, my task is to talk about the perinatal workforce, right? Bill. And definitely you want to talk about how this bill can help support the growth, specifically for doulas, but also lactation, peer support, community support workers, but also thinking even broader, of course, midwives, but also all pathways of midwives, broader thinking about high-risk doctors. We need to see more, BIPOC high-risk doctors, social workers, everybody that's putting their hands on birthing families. We need to diversify those aspects of that workforce. And like with this conversation comes talking about the benefits and the importance of cultural congruency, being taken care of by someone who looks like you. We are acknowledging harms that occur in a lot of our systems and how we have to work on trust. But, just thinking about just the level of, increase in stress, being able to interact with someone, not like you have to code switch. But I do want to also very clearly acknowledge, it doesn't make sense how many BIPOC providers we have if we haven't fixed our system, because they're just going to perpetuate the harm that exists from non-BIPOC providers. So still, this is a small piece of the overarching, not just the individual, but also a lot of these systems. But I want to also highlight things that, also need to be said, is that if we're going to increase this workforce, we have to work on our education systems that have caused harm, that are educating providers or creating barriers to have more BIPOC perinatal providers, bias programs, financial support for folks to go to school, and then also financial support after they graduate. Whether it is to transition into practice or as practicing, taking care of those high loans. Because what a lot of people don't also understand really affects where you work if you have a lot of student loan debt. It's really, really impactful. I am so honored to even have my little 5 minutes of gibberish here. So proud to be on the board of March for Moms. Outstanding speakers that we've already heard from today, and looking forward to who else is next. And thanks for having me, and thank you.
Thank you, Ebony, for your continued advocacy and speaking in support of the Perinatal Workforce Act. Next up, we're going to introduce Dr. Sarah Gordon. Sarah Gordon, PhD, is an assistant professor in the Department of Health Law, Policy and Management at the Boston University School of Public Health. She is a quantitative health services researcher with expertise in Medicaid policy, access to care, and maternal health. Her research has been published in Health Affairs, JAMA Internal Medicine, and the JAMA Health Forum, and featured in the New York Times, NBC News, and Reuters. She is the recipient of the 2020 Outstanding Dissertation Award from Academy Health, the preeminent association of health policy researchers. Her current research examines drivers of racial and ethnic disparities in maternal health outcomes in a Medicaid program and predicts the effects of postpartum Medicaid eligibility extensions. Dr. Gordon has a background in advocacy, working with the Utah Health Policy Project in Salt Lake City, Utah, on the 2018 ballot proposition to expand Medicaid, and with Community Catalyst in Boston, Massachusetts, on implementation of reforms to the individual health insurance marketplaces under the Affordable Care Act. Please welcome Dr. Sarah Gordon.
Thank you so much to the March for Moms team for having me. It is truly an honor to be here among these incredible speakers to discuss the Data to Save Moms Act, a bill that will significantly increase what we know about maternal health in the US. I spend my days as a health policy researcher at the Boston University School of Public Health, studying the effects of healthcare policies, particularly Medicaid policies, on maternal health. Foundational to this work is the ability to assess meaningful measures of maternal health outcomes among different racial and ethnic groups, across rural versus urban divides, and among populations that experience disproportionately adverse pregnancy outcomes. The goal of this work is to identify effective strategies to reduce disparities in maternal health outcomes. But if we are going to fix an issue, we first have to understand it. Data collection on maternal deaths, complications, and other health outcomes is challenging. Currently, significant data limitations hamper the ability to understand patterns in maternal health with sufficient accuracy and detail. This limits our ability to inform and guide evidence-based policymaking to improve equity. We are far past due for strategic investments in the quality of maternal health data collection systems. Between 2007 and 2018, the US just didn't even officially report a maternal death rate. While improvements have been made, we still have a long way to go to develop a nimble system that can translate into expedient policy recommendations and targeted public health investments. The Data to Save Moms Act is a critical first step towards that goal. The Act tackles this issue head-on by establishing a task force to review current practices for maternal health data collection. While this may seem like quite a technical element that's very in the weeds, I cannot underscore how important well-defined maternal health measures that are collected reliably across racial and ethnic groups are to a range of stakeholders, including researchers, public health professionals, clinicians, health systems, and policymakers who use this information to make decisions. Data drives change. With respect to health equity, this task force would determine how best to overcome existing challenges correlating maternal health data with race and ethnicity information. They would consider how to incorporate the firsthand perspectives of pregnant and postpartum individuals and family members, particularly those belonging to minority groups, and understand how non-clinical factors may contribute to maternal deaths to inform community-engaged policy solutions that extend beyond the hospital walls. A responsibility of this task force that's very relevant to my own research is the review of current healthcare quality measures for maternity care. These quality measures have enormous influence in the healthcare system. They affect how health plans, health systems, and providers get paid for maternity services. But currently, these quality outcomes are essentially limited to whether and how frequent prenatal and postpartum visits occur. In my ongoing work, I'm studying the effects of the state option to extend pregnancy-related Medicaid coverage from the typical 60-day postpartum limit up to 1 year after delivery. This is a policy that's also in the Momnibus bill. However, my colleagues and I are limited by the lack of meaningful postpartum quality metrics and incomplete race and ethnicity data. We need to be able to assess health measures that promote health, including physical and mental health conditions that can detract from quality of life, and what types of services postpartum individuals should be receiving. We should have the tools to be able to not only prevent negative outcomes, but to promote well-being and thriving. The Data to Save Moms Act has a particular focus on the maternal health of Native and Indigenous populations in the US, and would commission a comprehensive study on maternal health among Native American pregnant and postpartum individuals. It would also establish the first tribal maternal mortality review committee. This issue is urgent. The rate of pregnancy-related deaths among Native American populations is over twice as high as the rate among white populations. Finally, this act includes several provisions to increase diversity and representation among the entities that are engaged in maternal health data collection and analysis. This includes direct funding and assistance to state and tribal maternal mortality review committees to promote diversity and community engagement, as well as grants to minority-serving institutions to increase representation within the research workforce as well. While a lot of these measures might seem very upstream and like they might not affect you or a loved one at your next maternity visit, they will have direct impacts on patients and families. Together, they provide the data infrastructure to guide how state and federal policies are designed, how hospitals and health plans get paid, and inform public health strategies that ultimately impact the care that each and every birthing person will receive. The Data to Save Moms Act will lay the ground for meaningful reforms to bring us closer to our goal of improved maternal health outcomes and equity. Thank you so much for the opportunity to speak about this important bill.
Thank you so much, Dr. Gordon, for your voice and your work in data and how it can drive us forward. I am excited to introduce yet another amazing Pittsburgher, Michelle Naccarati-Chapkis, who is currently the Executive Director of Women for a Healthy Environment in Pittsburgh, Pennsylvania. Women for a Healthy Environment addresses environmental exposures that impact public health, with an emphasis of working in and supporting environmental justice communities. Michelle has worked on the passage of various environmental and health legislation, including the Clean Air Act for the City of Pittsburgh, the Clean Indoor Act for Allegheny County, and various rules and regulations proposed by the Environmental Protection Agency. I will now pass it to Michelle, who will speak on the Protecting Moms and Babies Against Climate Change Act.
Thank you, Morgan. Good afternoon, everyone. Thank you for providing this opportunity to join March for Moms and all of you. As Morgan mentioned, I'm Michelle Naccarati-Chapkis, Executive Director at Women for a Healthy Environment in Pittsburgh. But most importantly, I'm a mom of 3 children, and the oldest of which, who may be a mom, was born today. So it's an exciting day for me as well on all fronts. As background, our nonprofit organization educates and empowers community members across Western PA about environmental risks, so they can make healthy choices for themselves and their families and advocate for change for a better tomorrow for all. By translating scientific information for general consumption, we offer community programming and technical assistance to teach people the steps they can take to protect themselves, their families, their community, and the environment. We operate 3 main programs: Healthy Homes, Healthy Schools PA, and Healthy Early Learning, all of which have at the very core protecting women's and children's health. I am here today to share that the threat of climate change is real, and frankly, we are already at our tipping point. We know that climate change will and is disproportionately impacting communities of color across this country. To demonstrate the breadth and need for this critical conversation today, I want to share some startling statistics about my own community. According to the 2019 Pittsburgh Inequality Across Gender and Race Report, Pittsburgh's Black fetal mortality is higher than Black fetal mortality in 94% of similar cities. Black women's maternal mortality is higher in Pittsburgh than 97% of similar cities across our country. And Black mothers are 3 times more likely to give birth to children with extremely low birth weights. But we know that policy interventions such as what we're describing here today can change that. We recognize that this is a call to action to do better. Our city and county councils both passed resolutions over the last year recognizing that systemic racism is a public health crisis, and we know that now is the time to act. As an environmental health organization, we focus on social determinants of health in our decision-making processes. We must reduce the disparities that exist between communities and improve the health of those living in underserved communities. We must collaborate to bring solutions to those neighborhoods most at risk, including environmental justice communities that significantly bear the burden of climate change. This includes community empowerment, resident engagement, and policy change, each playing a critical role in addressing climate change and creating sustainable communities across our country. Scientific studies indicate that extreme weather events such as heat waves and large storms are likely to become more frequent or more intense with human-induced climate change. Between 1958 and 2010, the northeastern part of our country saw more than 70% increase in the amount of precipitation falling. We have record-setting daily high temperatures. We've become more common in record lows, resulting in more heat waves. The decade from 2000 to 2009 had twice as many record highs as record lows. According to the U.S. Climate Change Science Program, northeastern cities are likely to experience some of the highest numbers of heat-related illnesses and deaths compared with the rest of the nation. We know that more heavy precipitation events lead to more flash flooding, and that's often witnessed in our own backyards. The current 100-year flood levels will change and are now predicted to have 100-year flood events every 10 to 22 years. This results in human lives taken, families displaced, home and personal property lost, infrastructure destroyed, and the economy impacted. This also leads to waterborne illnesses from sewage overflows, which is already a stress system in my region and a breeding ground for insects carrying disease. Air pollution is a primary driver of climate change. More hot summer days also means a greater impact to air quality and results in additional air quality action days. These are days when residents are informed that it's unsafe to be outdoors due to air quality, often associated with an increase in both particulate matter and ground level ozone. An increase in ground level ozone results in an increase in asthma rates. Already in my region, we have seen a significant number of air quality action days just this year, meaning it's unhealthy to be outside, especially for pregnant women and children. Scientific studies demonstrate the heavy health burden pregnant women bear due to air pollution exposure. The developing fetus is particularly susceptible to environmental pollutants, and evidence has shown adverse effects on air pollutants on pregnancy and birth outcomes. In addition, scientific research has confirmed that air pollution is associated with heart disease and lung disease, premature deaths, and cancer. My county, Allegheny, is in the top 2% of all US counties for risk of cancer caused by air pollution. Further, an estimated 25 million Americans suffer from allergies. Unfortunately, an increase in temperatures, carbon dioxide, and precipitation are proving to make our allergy symptoms worse and longer every season. Spring is arriving earlier, meaning longer days for tree pollen sufferers, and it's likely that non-sufferers will be impacted by these allergens as well and develop symptoms. A local report in Pittsburgh found that asthma rates for children in our region's environmental justice communities, often plagued by industrial pollutants, is 3 times higher than the national average. Already, a national epidemic, federal data report a 17% increase in US asthma prevalence from 2001 through mid-2012. Allergies and asthma rates already cost the United States nearly $33 billion annually in direct healthcare costs and lost productivity. And that which nourishes us each and every day, our food, is becoming greatly impacted by climate change. Think about a mom's vigilance to feed herself well during pregnancy, knowing that she is providing nutrients for her growing baby. With climate change, many agricultural regions will experience declines in crop and livestock production from increased stress due to heat and drought damage, weeds and disease, insect pests, and other climate change-induced stresses. We see crop yields declining and increased risk of hunger and changes in retail food prices. And if the pandemic has shown us anything, it has demonstrated that when a national crisis happens, food insecurity is real. It is too common across communities, and it's rightly placed, frankly, at the top of priorities and urgent needs. So as I've shared here today, there are many public health impacts associated with climate change, especially those that threaten the health of moms and babies. Policies such as the Protecting Moms and Babies Against Climate Change Act is one critical component to addressing this harm. All public health policies must be written through a lens of how does this improve public health? It must address the intersections of racial, environmental, and social justices, and this legislation does just that. We can and we must do better, and won't you join us? Thank you so much for your time today.
All righty, we will now go straight into our community call to action, which will be given by Ginger Breedlove, President and co-founder of March for Moms.
Wow, what a phenomenal lineup to discuss the Momnibus Act today. Thank you, Lanicia, to you and the Planning Committee. As co-founder and president of March for Moms and a mom of 4 adult sons who had no idea we had a maternity care crisis in the US until 2016, we have a long ways to go. In the fall of 2016, a handful of diverse healthcare professionals got together to talk about why the US had not prioritized care for childbearing families as they had for many other health issues. So we took action. We brought together diverse stakeholders with a common passion to create a stronger unified voice in DC with 3 annual rallies on the National Mall, as Charles shared earlier. Then last year, due to COVID, we pivoted to a virtual town hall. And Charles, I want nothing more than to be on the mall next year to give you a big hug and continue to stand beside you. So what are we asking? Over the past 90 minutes, you heard personal stories and discussion about how specific bills can bring needed change via the Black Maternal Health Momnibus Act of 2021. But most Americans and even many elected officials in hearings that I've sat in on remain unaware around the longevity of the crisis, contributing factors, and necessary steps to reverse the risks associated with giving birth in America. Can your friends, family, or elected officials answer these 3 simple questions? Why are outcomes around childbirth worse than any other high-income country, yet we spend more on costs of care? Why do significant inequities exist among childbearing people? Why have we refused to acknowledge and address these issues? So today we're asking for your help in a nationwide campaign to demand action and to prioritize needed policies. Policies that provide funding to improve the way we care for and support all childbearing families. Charles Johnson's wife, Kira Dixon Johnson, is not here today to share her story. Kara is a Black American woman that died related to childbirth. Racial, ethnic inequities and maternal death are unacceptable. To repeat Dr. Joia's comments, the root cause of these inequities is the consequences of structural racism that permeate people's lived experiences, including their experiences in receiving maternal health care. One of the drivers of the inequities is distrust in our healthcare system as a result of historical and contemporary discrimination, which can manifest as less engagement within the healthcare system. And equally noted in research is white healthcare providers' disregard acknowledging Black and brown person symptoms associated with pain. Another group represented today are voices from among the estimated 70,000 families per year who experience severe maternal morbidity, also called near-miss events, before, during, and after pregnancy. The CDC reports that these events have been steadily increasing in recent years, but we have no national data on near-miss events since 2014. Why? The UK has been collecting this national data for decades. In 2018, the CDC reported findings from 9 state maternal mortality review committees. More than 60% of pregnancy-related deaths were preventable, and the leading factors contributing to death were associated with 3 categories: patient family factors, namely a lack of knowledge about early warning signs to seek care, provider factors, misdiagnosis or ineffective treatments, and factors related to systems of care, a lack of coordination between providers. And here's even more perplexing information about why US data describing what is really happening to families is completely unreliable. Only 35 of 50 states, DC and New York City, are required to review deaths that occur up to 1 year postpartum. Only 30 states, DC and New York City, are required to review every pregnancy-associated death. Only 13 states, New York City and Puerto Rico, are required to determine if a pregnancy-related death was preventable. Only 14 states and New York City evaluate maternal morbidity, the near-miss events. And only 7 states, DC and New York City, investigate or consider the question if racial disparities and equity occurred in the demise. Why don't we care enough as a society for every state to investigate each of these defined events in order to eliminate preventable death and injury? Hashtag data drives change. If you want to help push for change, we've made it easy. Here's what you can do today. Go to the March for Moms website. Find the Advocacy tab that takes you directly to the Legislative Action Center. With the support of the Society for Fetal Medicine, we have a platform ready for you to use where you can send a pre-written message to your representatives to support the Momnibus Act of 2021. It simply takes no time at all. And if you want to go a step further, I challenge you to scroll down that same page to the Day of Action Toolkit and find one additional way to share something you learned today with friends, family, your workplace, or community. Change will only come when a tipping point of the American public are aware of the crisis and are willing to join together in voice and action to demand change. Will you?
Thank you, Ginger, for informing everyone on the ways they can take action to eliminate disparities in maternal health care. Before Dr. Neel Shah brings us home, we want to hear from you using the poll on your screen. How do you plan on taking action this week? All right, while everyone is answering that final poll, Dr. Neel Shah, Vice President and co-founder of March for Moms, will close out our town hall today.
Thank you, Lanicia. My job today is just to thank everybody. I am so moved and inspired by all of you, by each and every one of our speakers today, and by everyone who took time in the middle of their day to attend. When I look across the attendee list, I see people who are role models for me, people who've been part of this movement for a long time. I see people who are clinicians, I see people who are birth workers, I see a lot of people who are moms, and I see people who are new. And it just reminds me so powerfully, as Ginger and Charles also mentioned, where we started. You know, this was an event led by volunteers that became a project, that became a movement. Now it really feels like a revolution. And I just think that as we emerge from this pandemic, we have an opportunity to build a system that is more worthy of the trust of birthing people in this country. And I think that the program today is such a powerful demonstration of that. Thank you to our sponsors. Thank you to the board for making this possible. Thank you to our volunteer steering committee. Thank you, Morgan. Thank you, Hope. Thank you, Julia. Thank you, Katie. And most of all, Lanicia, thank you. You are the most extraordinary leader of this organization that we could have possibly found at a moment where really the sky is the limit of what we can do. We got through the whole Momnibus in like an hour and 15 minutes. It was incredible. And so onwards, everybody. Thank you so much and have a great day.